No, those are good. No, they're great. This is great. I want to get up to 500 videos. So this is another one. Good. So the question comes up, what is sleep apnea? And there are a whole list of these complications that go along with obesity. And as an introduction, I might say, obesity is not just looks. Okay? In other words, we're not doing this just to make you look better. Now, many times when you lose weight, our society says you are more attractive and there are cosmetic benefits. But obesity is not just looks. It's life and death. And how does obesity actually take people's lives? Well, it can cause diabetes, and diabetes can cause blindness and heart attack and stroke and death. It can elevate your cholesterol, which can cause heart attack and stroke and death. It can elevate your triglycerides. It can elevate your blood pressure, which can cause heart failure and heart attack and stroke and death. It can cause an increased risk of breast cancer and endometrial cancer in women through elevated estrogen. It can elevate your risk of a variety of other cancers in both men and women. Colon cancer, pancreatic cancer seem to go up in obesity. One of the pathologic side effects, that is one of the diseases caused by obesity, is damage to the lungs and to the lung function, which is breathing. Okay? Normally, you and I breathe without thinking. Okay? It's a reflex. We can go to sleep. We don't have to sit here. Right now, you and I can just sit here and talk. We could watch a movie. We could play golf. We could do anything, and we don't have to think about it. And the idea there is, okay, we don't have to think about breathing, and it turns out because we have a respiratory center in the brain, and you may know there's this idea that the brain, as it goes from low to high, has more primitive parts down low, and the more advanced parts of the top of our brain is where we do the thinking and emotion and stuff like that. Well, breathing is a very primitive part of us. Even the lowest kind of form of animals have breathing centers, this respiratory center that's in the brainstem. Okay, if that center is messed up, we don't breathe. So that's why when you have a neck injury, you have to be on a ventilator, because that's where the breathing center is. As you sleep at night, fatty tissue falls down, the nervous system doesn't work as well as it should, and you actually can stop breathing. You should have a center, a reflex, that measures constantly your oxygen and carbon dioxide and adjusts your breathing. Because you and I, as we breathe, not only do we breathe, but we breathe just right. Neither too fast nor too slow. Precisely right to keep our carbon dioxide perfect. We have this amazingly accurate measure of carbon dioxide, and if we make a little bit more, we breathe a little bit more and take care of it. And if we slow down and make less, our breathing slows down. And that system in the brainstem is messed up in obesity in some cases. So that when you're sleeping at night and the oxygen goes low, and you should turn on your breathing, paradoxically and in a deadly, diseased way, your breathing may stop because of the swollen brainstem.
It causes headaches too, doesn't it?
Absolutely. We talked the other day about that swelling in the head. You get a headache, you get a swollen brainstem, you get inappropriate management of this really miraculous system, and it can lead to deadly hypoxia or low oxygen and death.